Students, today's class we will see the nursing foundations questions and other answers part 3. In these sessions we will see these 8 questions. First is nurse-patient relationship, essentials of good communications, barriers of communication, role of a nurse in discharging the client, importance of documentation in nursing, surgical asepsis, nursing intervention of patient with dyspnea, and nursing intervention of patient with fever. We'll see one by one. The first one is nurse-patient relationship. The client is the most important person in the hospital. The client in the hospital experiences new and unfamiliar surroundings. Due to hospitalization, the client faces physical and psychological problems. It is up to the nurse to see that he feels homely. Treat him as an individual, understand him, and help him to overcome his fear and anxiety. Help him to adjust to his routines of the new environment and help him to cooperate and accept treatment necessary for regaining his health. She should be sympathetic and understanding in nature. She should create a confidence in the client about the care taken by the health team. She should establish a good nurse-patient relationship. Always speak of the client by his name, not by the bed number or disease. She should be pleasant, cheerful, and courteous, but she should not be too familiar. She should neither discuss on personal affairs nor about other clients or whisper anything in front of him. She should not have any discrimination between caste and creed, rich or poor. She should not accept any gift or personal favors from the client. Learn everyone's name and address them by their names. Respect everyone's individuality. She should not accept any gifts or personal favor from the clients. Should not show any discrimination in terms of caste or religion. Never discuss personal affairs, not about other patients. Always speak of the patient by his name, not by his bed number. Should be able to create a self-confidence in the patient. Second, essentials of good communication. Communication means interchange of thoughts or information conveyed to person in such a way that meaning received equivalent to those which initiator or the message intended. Essentials of good communications are sender and the receiver use the same language and express the ideas commonly understood words with brevity and completeness. Avoid technical words and abbreviations that are not in use. There should not be clarity in the expressions of ideas. The sender clearly state what, when, why, where of any specific event. Without this, people make assumptions. Make sure that receiver received the same message by appropriate questioning. Pay attention to the nonverbal message accompanied the verbal message. Nonverbal message are much closer to the truth than the verbal message. One should be aware of both relevance and timing when communicating with others. There should be adjustability and adaptability. Spoken message need to be altered according to the pattern of the receiver, which may change hour by hour or day by day. The sender has a thorough knowledge of the subject being discussed, and the information that is given by her should be accurate in order to create a confidence in others. To be really helpful, the nurse continuously develops her skills of effective communication by listening, problem solving, and self disclosure. Listening involves attending to the word person. In addition to the hearing the spoken words, it is important to consider the nonverbal message that accompany them. To be a good listener means face the person who speaks, maintaining good eye contact, maintain a natural, well relaxed posture that indicates your interest. Getting and giving feedback is essential for effective communication. Barriers of communication. Communication means interchange of thoughts or information conveyed to person such a way that the meaning received is equivalent to those which initiator of the message intended. There are some barriers of communication which prevent the recipient from receiving what the person is meant. They are emotional factors such as fear, suspicion, jealousy, anger, anxiety, resentment, antagonism, prejudice, lack of interest, and lack of listening. Physical factors such as fatigue, illness, speech defects, deafness, and pain. Intellectual factors such as low IQ, lack of knowledge, misinterpretation of the words. Social factors such as difference in culture, language, race, professional status, socio-economic status. Environmental factors such as noise, lack of privacy, uncomfortable accommodations. Communication may be blocked by following, changing the subject, lack of listening, inappropriate use of knowledge, jumping into conclusions, false and inappropriate reassurance, stating one's own opinions and ideas. Role of a nurse in discharging the patient. In care of the client in illness, there is admissions and discharge are the major factors for total impressions made on clients by an institution. Discharge from the hospital should be never come unexpectedly to the client or to those attending them. The nurse should keep in following things in mind before discharging the patient. They are: no client should be discharged from the hospital without doctor's written order. Physician writes on the client's chart when the client to be discharged. Instructions regarding further care, medications, treatment, and follow-up should be clearly written and interpreted to the client and family members. Provide the client with the medication or direct him to the purchase what is needed for him. Client personal belongings such as clothes, money, and other valuables which were entrusted to the hospital personnel at the time of admission should be checked and returned to him. Any of the hospital property that is given to the client for his use in the hospital should be checked and received back before he leaves. Before the client leaves the hospital, the nurse should confirm whether he paid his hospital bills. See that the client is ready to go home. The client is not able to walk or allowed to walk. Nurse should see that she is safely transferred either on a wheelchair or on a stretcher. Dietary department should inform the client's discharge. If the client leaves the hospital against the medical advice, he should be asked to sign to release him. The nurse should see that charts are completed and sent to the office or MRD to be built. Importance of documentation in nursing. Effective communication among the healthcare professionals is essential for the coordination and continuity of the care. Documentation is a written legal record of all pertinent interactions with the client, assessing, diagnosing, planning, implementing, and evaluating. Documentation is recording of information relevant to assessment, planning, implementation, and evaluation. Client's record is completion of the client health information. Purpose of documentation. First is communication. The primary purpose of the documentation is the communication among the healthcare professionals to promote the continuity of care among the departments throughout 24 hours of care during the entire hospital stay. Quality assurance. An audit is the review of records. As part of a quality assurance program, the healthcare agencies periodically conduct short audit to determine whether or not the care provided meet established standards of the client care. Reimbursement. Cost awareness has become important for the client care by insurance companies and other agencies are done after a review of the client's record. Legal accountability. It may be used as evidence in court proceedings and therefore they play an important role in implicating or absolving the health practitioners charged with proper care. Record also used in accident or injury claims made by the client. Research. Nursing and health research is often carried out by studying the client's records. Researchers might study client records, hoping to learn how best to recognize or treat identified the health problems from study of the similar care. Diagnostic and therapeutic orders. Decision analysis. Information from the record often reviewed to get a sufficient data for administrator to do strategic planning regarding the needs of the client. Education. Members of the team, including students, utilize these records as an educational tool. Vital statistics. Client record registers an important furnish vital statistics and give information needed to the evaluate service rendered by the agency to the community. From these, it is evident that documentation in nursing plays a major role in rendering care to the patient. At times, it also helps nurses to save themselves from legal proceedings if they documented correctly and properly what they have done and what they have not done. Surgical asepsis. Surgical asepsis is the preparation and handling material so as to prevent exposure to any living organisms. Nurse practice surgical asepsis thorough sterile technique. Sterilization is the process by destroying microbes including the spore. Principles are: always face the sterile field, do not turn your back or side to sterile field. Keep sterile equipment above your waist level or above the table level. Do not speak, cough or sneeze over the sterile field. If it is necessary to do so, turn your head away from the sterile field. Never reach across the sterile field. Prevent excessive air currents around the sterile area. Air currents can be caused by moving fast, flapping the cloths and drapes, and by closing the doors, etc. Keep the unsterile objects away from the sterile object. Edge of sterile field is considered as unsterile. Each sterile supply should be clearly labeled as to its content, time, date of sterilization. Never assume that object is sterile. Always check the sterility expiration date. Avoid sweeping and dusting when the sterile objects are open. Wash hands, put on gowns, gloves, and masks before handling the sterile equipment. Often packaged in such a way that edges of the wrapper is directly away from the work. Performing sterile procedures, wear cap and mask, opening the sterile packs, preparing the sterile field, surgical hand washing, applying sterile gloves, wearing the sterile gown. Nursing intervention with the patient with dyspnea. The term dyspnea means difficult or labored breathing. That means there is a subjective sensation in which efforts of breathing reach into the consciousness. When it occurs, there is insufficient exchange of oxygen and carbon dioxide causing tissue anoxia or cyanosis. When we come across a person who has breathing difficulty, it is necessary to assess the degree of dyspnea, making the right nursing diagnosis and prompt nursing intervention to relieve dyspnea. Psychological support. A dyspneic patient is very anxious and needs to be reassured. The nurse in care of the client should stand with the client and encourage him. Ventilation of the lungs. If the respiratory mechanism is failing, ventilation of the lungs achieved by artificial ventilation. Positioning of the client. The most appropriate position for a dyspneic patient is propped up position, which can be maintained by backrest and extra pillows. Oxygen inhalation. The client is cyanosed, it indicates lack of oxygen supply. The tissues oxygen is given. Clearance of air passages. If the secretions are obstructing the air passage, it has to be cleared by appropriate means. Breathing and coughing exercise. The client is asked to cough out sputum if any and to breathe deeply and rhythmically in order to aerate the lungs. Postural drainage. If there is secretions collected in the lungs and bronchioles, postural drainage will help the drain secretions. Steam inhalation. The steam inhalation is facilitated to smoothen the mucosa and liquefy the sputum and expectorate it out. Nutrition. Small and frequent feeds are appropriate for a client with dyspnea. Overloading the stomach with the food will increase the dyspnea. Nursing intervention of patient with fever. Fever defined as rise of body temperature above 99 degrees Fahrenheit. In fever, almost all organs are affected. It may vary in nature of the disease. The main cause care in the fever includes regulation of body temperature. When the client temperature moderately elevated, various methods used to reduce the temperature may start up. It includes exposure to cool by electric fan, administration of cool drinks, application of cold compress and ice bags, cold sponging, cold packs, cold bath, ice cold lavages and enemas, use of hypothermic blanket. When surface cooling use, treatment is directed not only cooling the body but also preventing shivering, as it may increase the metabolic activity, produce heat and increase oxygen demand considerably. Meeting the nutritional need, cellular metabolism increase during fever, oxygen consumption in the body tissues increase approximately 13% for each centigrade of rise in fever. The client tolerates solid diet, should be given small and frequent feeds. Never force a client to take any food he dislikes. In order to induce the appetite, the diet should be served attractively. Providing rest and sleep. All clients having fever should be asked to take complete bed rest. To ensure rest and sleep, provide a unit which is calm, quiet, without bright light and glares. Maintenance of personal hygiene. Care of mouth is very essential for clients having fever for many days. If oral hygiene is not maintained, many complications may arise like peritonitis, sores, and crust. Care at the pressure points and skin are essential to prevent bed sores. Sponge bath given daily to keep the client clean. Safety factors. Never leave a client with high-grade fever alone. Rigors and convulsions may occur at any time, and the nurse should keep the entire article ready to act quickly on such occasions. Surface cooling should be done gradually. Sudden cooling can cause serious effects as cardiac arrhythmias. Observation of the client includes client with fever need constant intelligent observation. Vital signs to be checked frequently to know the progress or regressions of the disease. When any type of cold is applied, the temperature should be taken by rectal method to get accurate body temperature. Thank you.